Good morning, everyone. My name is Sherry Everhart. I'm the Deputy Director of Community Services for the City of Hyattsville. I also serve as the staff liaison for the Health, Wellness, and Recreation Advisory Committee. This morning, I would like to welcome Mayor Robert Crosland. Good morning, Mayor Crosland.
Good morning. Thank you.
And Dr. Diane Waugh, who is a member of the Health, Wellness, and Recreation Advisory Committee. And we want to welcome as well Dr. Cheryl Holder.
Morning.
Good morning.
Good morning. Glad
yes, I'm looking again. As what? You can see how often I do this. Sorry. I'm a member of the Health, Wellness, and Recreation Committee, and our committee has been focusing on bringing speakers and holding activities that will meet the needs of our residents based on a survey that we put out for them. And what they said they were interested in, one of their interests was climate and health effects of climate on humans. So I'm fortunate enough to know Dr. Cheryl Holder. She's a graduate of Princeton University and George Washington University School of Medicine. She's a National Health Service Corps scholar, an internist, and an HIV specialist. She served as medical director of one of Miami's largest community health centers and on NIH and CDC health advisory and programmatic review panels. She's dedicated her career to improving the health of underserved populations. In 2009, she joined the faculty of Herbert MLK Wertheim College of Medicine at Florida International University. She taught about the social determinants of health, diversity, HIV prevention, and the health impact of climate change. She served as Associate Dean of Diversity, Equity, Inclusion, and Community Initiatives until her retirement on December 31st of 2022. Congratulations. Her leadership roles extend to several medical and climate change focused organizations. She's president of the Florida State Medical Association, founder and co-chair of Florida Clinicians for Climate Action, and co-chair of Miami-Dade Heat Health Task Force. Most recently, her TED Talk, which you can Google, her TED Talk is entitled The Link Between Climate Change, Health, and Poverty, and it's garnered over 250,000 views. So I would advise you to listen to that. So with that introduction, I'm really excited that we have Dr. Holder with us. So thank you.
Thank you, Dr. Waugh. Thank you, Ms. Everhart. And I'm really in Mayor Corson.
Shopify presents full sheets from AHA to...
Okay. I'm really happy to be here to talk with the folks in Hyattsville, Maryland. And like you heard, I was at George Washington, so I know Hyattsville well. I've been there several times, and lovely community. I'm going to share my screen and start the presentation. And you could save what you've heard in the bio. I don't have any conflict of interest, nothing to disclose. And I always do a little learning objectives for all my talks, so just keep folks a little focused. Try and remember 4 things that you've learned today. What are the health impacts? The populations, about 4 populations are most vulnerable. Think about policy, how policy impacts lower wealth and vulnerable populations, and things that clinicians can do that you can take back to your clinician. And I always start my talks with Miss Anime, because this is way back in 2016. And 2016, I've always been doing work with environmental justice, talking about pollution, talking about the health impacts of pollution. But 2016, this older Black woman came in, not so older, but she was 64. She had recently retired, was not on Medicare as yet. And so we help out populations like that in my clinic. And she's really very adherent, but for some reason she had to walk in, and I was rushing through the day. And so I'm like, okay, I'll refill your prescriptions, but this isn't like you, we got to talk. And then she goes, right as I said, as I refilled it, she says, can you help me with my light bill? Because I'd fallen behind in my light bill. And that's when I took a little step back and for a moment, that aha moment, what is going on? Worsening breathing, worsening complaints of a woman who's usually really on top of things, fixed income, can't pay her bills. And she's one of these older Southern women who take pride in keeping all things, as difficult as it is for her and her fixed income, keeping up with things. And she had fallen behind. And that's when I started thinking more and seeing more patients with these issues. My lawn workers were complaining of the heat. My lawn folks were talking about allergies. People were coming in with different symptoms, all coming around what I started seeing on the news and everywhere, that 2016 was one of the hottest years on record. And 2016 is an El Nino year. So think about this year, which is also an El Nino year. So we'll get into that later. And so I started doing my own research because there really wasn't much out there for doctors, for anyone. No one was talking about climate change and its impact on health. We were all thinking about the polar bears and the Arctic melting, and no one was thinking what's happening now. I would think it's 20, 30 years down the line, but every day I saw more people saying something's happening to me. And when I looked into it, you saw that over the years, you're seeing the temperatures going up, not just in the daytime, but at night also. And night is crucial for the human bodies, for humans to cool down so we can then adjust and be ready for the hot days. And when your nights are hot and your days are hot, you end up like Miss Anime, constantly having trouble breathing. And when you look into the history of when did this pattern change? Now, this is the key issue where folks say humans, and the science clearly shows that humans have an effect on what naturally happens to our planet. So our planet has always had a cycle of rising temperature, cooling, rising, cooling, but it has maintained a range. Yet in the 1800s, we started seeing that range edging up and up and up. And as more and more pollution from our factories, from the transportation, from everything we're doing, putting these gases in the atmosphere and all these particles in the atmosphere, we started seeing the temperatures going more. So this is why we said humans stepped in, did something to the planet that is causing these changes. And what is that something? So you look at the atmosphere, and this looks a little bit crowded, but it's real important to understand when we talk about greenhouse gases, we're talking about different gases that the planet normally emits, and then put what we put on because of all our new industrialization. What brought us this new modern way of living included leaving stuff in our atmosphere. So that stuff goes around our planet, and the sun rays you can see in the slide, the sun comes in and usually bounces back out because there's a natural amount of what the planet puts out of CO2, of a little methane, and nitrous oxide usually comes off our planet. And so there's enough to bounce back out and keep our planet just right. Not too hot, not too cold, so we can live. When these gases go in, and we're talking about the methane and the fluorinated gases that comes when we put in, like what we did with our air conditioners, and when we burn all those fossil fuels, a lot more goes in. So instead of having a light particles surrounding our planet, think of putting like a fleece blanket going into a goose down coat around our planet. And that's blocking the sun from going back out, the rays from going out and coming back down on the planet. The water on our planet absorbs all this heat, and also the Arctic starts to melt. What we see mostly is CO2, and even the other gases we translate into CO2, too much CO2 traps and too much heat. So as this has been happening over the last from 1800s to now, we're seeing that gradual shift over. So what this shows is that you're seeing a gradual shift of more days that are hotter than usual. And that is what we call the climate change. The weather pattern, that's the day-to-day temperature, those teeny weeny bitty increases over the 200 years is changing. And then that's where we see these new records, where we see 2016 hot, 2021 hot, 2022 hot. So that thin line of our atmosphere is, which has to be perfect to maintain the right temperature for our planet to be habitable. And for that to happen, not just for humans, but for insects and plants and everything on our planet, we need that amount of particles in our atmosphere to keep the sun rays to go back out rather than staying in. And we are gradually crossing a danger zone in that line. So what do we put in? You know where we're talking about, where it's coming from. Everything in the Industrial Revolution that has happened. We now have fabulous cars, but the cars use a lot of fossil fuel. Our factories, our agriculture also puts out. That's where the cows burp out all this methane, and all the cows that have taken over because we cut down trees to grow grass and to graze cows so we can eat a lot of red meat. We make our factories so we can produce all this plastic and all these products. We generate electricity and we push a lot of transportation. Commercial, residential, we all play a part. And when I look at the health sector, because we're talking about health, think about when you go to a hospital, how much electricity is being used, how much plastics being used, how much single use, because we say we need to keep everything as clean and decrease the transmission of bacteria and infections, but it's driven our health system to be very, very heavy use of fossil fuels in doing what we do. If the US health sector alone were a country, it would be the 5th largest emitter across the world. We are responsible for a lot of pollution as a health sector. And if we looked at the diseases, when you think about the health sector saying we're doing no harm, we are worsening pollution all over the planet and killing a lot of people right now because of that pollution, because of the rise in our temperatures. One of the areas that we got to look at is in landfills. Methane, even though it is not directly CO2, it is even more dangerous to the greenhouse gas and that layer. And one thing that we know much in the Northeast, there's a lot of landfills because of the population, and being that 3rd largest source of methane in the US are landfills, that municipal solid waste landfills. When you look in your county, Prince George's County, you already have 3 closed landfills. That's still emitting methane. And then the 7 open continues. Now, what do landfills? It's all the waste products, it's all the plants and the food and the cardboard and everything that we put in that gets degraded, and that then releases methane. And that release is very, very dangerous in our atmosphere. You know what happens with your highways, and there are many highways that you are having in your communities, so you can see what we can expect. What we look at the health impacts, you're thinking, and we want you to start looking at pollution, what's causing it, all that pollution, and then we create heat. So there's a direct effect of that heat on the body. There's a direct effect of the pollution. And what happens in our planet as the temperature rise, the Arctic melts, the oceans absorb the heat, and the heat in absorption in ocean and water, and this is just basic physics, when water gets hotter, it expands. You're putting more water because the Arctic and all the ice is melting, much more rise of the sea level. The water in the oceans get evaporated. So when that water goes up, more clouds, more moisture. So the changing in the temperatures between the Arctic and the equator, that generates the planetary winds. So as the changes in the temperature narrows and the drop of the Arctic ice, we're seeing wind pattern changes. So that's where you see extreme weather events happens more because there are different temperatures coming across the planet as it circulates. So directly, the weather changes that we see more extreme rain. So when it rains, it pours in a short amount of time because it's a whole lot of moisture. When there's a storm and the storm surge, because the oceans are higher and the wind will pick up the storm and bring a higher storm surge. So extreme weather events, tornadoes, everything will be extreme because the planet is changing and the weather patterns are changing. So those are the direct impact that will happen. When you look at the other effects that happens, because as the planet changes and it's getting warmer places and colder some places, what's going to move? Humans are going to start moving, insects starts moving, animals start moving. As things start moving, we see insects in areas that weren't there before. So we will start seeing malaria in communities that didn't have malaria because those mosquitoes are moving. So when you look at some of the patterns of where mosquitoes are moving to, so you'll see all of this change. You'll see the water gets contaminated from the flooding, and you'll see the food supply because of the different temperatures and rains. The trees are growing differently. We will see a change in what happens in our food. And then emotionally, if you've ever been through a hurricane, trust me, you are going to be stressed. That's just one of the triggers. But generally, as we talk about climate and people start seeing the impact, we're seeing some more anxiety, especially around young people. So we know there's disruption of well-being. So we can break down the health impacts, and we use this mnemonic heat wave just to sort of help you to think. Heat, 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 because the warming, so there are lots of variations across where heat can hurt you. There's worsening of your heart and lungs because as heat comes, your body responds, you can have the changes. I put asthma is big because the pollution and the heat and all the other changes and the stress and anxiety can trigger asthma. Traumatic injuries, between the heat and the storms, you have increased risk of getting hurt, especially after storms. So we see an increase in traumatic injuries. We talked about water and foodborne illnesses, allergies, allergies, allergies. The changing in the pattern of the way the temperatures come on have been triggering our trees to think the seasons are starting earlier. So the spring is coming earlier, several weeks earlier. So when the temperature rises, the trees are saying it's time to flower. We're seeing more flowering, and the trees are also moving because where they could live before might be a little bit hotter. So we're seeing trees move into different temperature zones. So now we're getting more adults who are developing allergies for the first time because they're living in an area with a new tree that they didn't know those trees were going to come in there, but climate change is causing migration of trees. So allergies, wildflowers, everything is changing. Again, the vectors, and we'll go through more in the emotional stress. So when we look at heat, I use Florida because this Florida, we call ourselves, we're ground zero, because when you look at the days, this is when we talk about the gradual shift. And I tell folks, when you think about heat, think about a newborn baby. When that newborn baby is 98 degrees, when it goes up by 1.5 degrees, 99 something, you start worrying, that baby is having a little problem. And you are not going to not pay attention to that baby's temperature. So we say when the planet warms about 2 more degrees Celsius, which is taking you from 98 to about 100 point something. If you have a baby that went from normal to 100 or 101, that is red flag, bring out the doctor, get some help. That's what's happening to our planet. It's that incremental change, but think of it like a baby. That incremental change impacts the planet. And so when you look at Florida, which all my patients say, but we're always hot. I said, yeah, we're always hot. But the extra 1 or 2 or 3 days means something. And by 2036, that's not too far away. 1/3 of our days will be feeling like 90s to 100. Think about when you come to Disney World and you know how hot it is now. Can you imagine walking around outdoors in Disney World? So it's those slight increases over time. After about 90 degrees, when it feels like 90 degrees for humans, we can still work, but it changes your productivity, it changes everything. And in the Northeast, especially in Maryland, what happens because you have winter, spring, you don't acclimate as rapidly or like we are in Florida. So you get heat waves, and that's what really takes people out at large numbers. So you see the increase from just getting your heat rash to the sweating, to the heat syncope and heat stroke in different degrees. And heat is the #1 weather-related killer. And folks don't realize how dangerous heat is. We also see with pregnancy, and this is a much newer finding that we are finally able to look at the data. Now, we can't say this is cause and effect because this is all new data, but it is very clear that environmental factors, that pollution we know crosses the placenta and it crosses from the mom into the babies. And we're seeing that their impact in probably looking at preterm labor and low birth weight because of the pollution. Then when you look at temperatures, when the temperature is higher, we see higher risk of dehydration for pregnant women and increased amount of preterm labor again. Now we see it even more in Black folks, and we'll learn more. You know, race is just a social construct. It doesn't mean more than what has happened to a population that puts them at risk in an environment that puts them more heat, more risk of dehydration, and poorer birth outcomes. And we're beginning to see that, especially with that clear racial disparities. And so we're investigating more. Why are Black folks in these conditions? Why are they getting more exposure to environmental toxins? Why are their neighborhoods hotter than usual? And what makes these pregnant women then go into labor earlier? We know about asthma. Again, we've always seen the Black and Hispanics with higher rates of asthma. Now we fully understand, as we've been going through, that Black folks live in environmentally toxic environments. So they have higher levels of CO2 in their day-to-day exposure. And this is rich, poor, middle-income Blacks. The data is clear. The neighborhoods that are predominantly lower wealth end up with more environmental disastrous areas, which then increases the exposure to ground level ozone, increases the exposure to pollution from transportation, agriculture, and all those things, and increases their asthma. So many of the kids that we see, African Americans and Black, have higher rates of asthma. And again, African American women have some of the higher rates of dying from asthma attacks. And children especially, and I put these pictures in, not so much you're going to memorize anything, but you see the kids, you see older people, you'll pay attention. You see Black folks, you'll pay attention because kids are lower to the ground. So what goes up goes down, comes down on the ground. So they're much more exposed to the pollens. They're much more exposed to ozone. They're much more exposed to the pollution. So kids pay a higher price when it comes to what happens with climate. And when we look at vector-borne diseases, these are vectors, are insects that transmit diseases. Humans can be a vector, but many of the vectors we see are like ticks and mosquitoes. And when you look at the range and you look at this maps on the side, you'll see a changing of this Aedes aegypti mosquito is moving further north because those little 1 or 2 degrees more impacts the rest of the United States. So we will end up seeing more diseases that you haven't seen in northern areas. So things like Zika, chikungunya, we can expect to start seeing that move further north. It's just like Lyme's disease that used to be much more in the Northeast and the New England states. They are spreading further down. And Lyme disease is from a tick. We're also seeing other ticks that's coming from the Southwest, like from Texas and Arizona. Those ticks are moving further north, and we're seeing things like that makes you allergic to red meat because those ticks are biting cows and other animals, and they have a sugar in their blood that humans don't see, and that's creating a whole new set of allergies that we call the alpha-gal syndrome because those ticks are moving. So as the trees move, the vectors move, more diseases in areas that we haven't seen. And I can tell you, I had a patient back in 2017. And again, Miami, we get quite a few undocumented workers that work in our various industries, but she ended up with Zika. It turned out that the Zika was not brought in from abroad. She got it right here in Miami because our vectors brought the diseases, because there was a Zika epidemic in Brazil and in South America, and it moved up with that Aedes aegypti mosquito, and we had a Zika outbreak in Miami. Luckily, her baby was okay, but it led to postpartum depression and all the other complications from that. And that's just the vectors moving into Miami. We're seeing also air pollution linked with coronavirus. And so when we think about air pollution, it's not only deadly to pregnant women, the children, but it causes increased transmission of other viruses. The particles are a certain size, and viruses hook onto particles in our atmosphere. Then as you breathe in, you're more likely to get a larger dose of those infected particles. But I think of it like infected particles that you breathe in. So again, when you look at fine particulate pollution, which communities had them, which communities got a higher level of coronavirus infection, and which communities died. So this air pollution, heat, all makes it easier for certain people to be impacted now. And I talk about flooding after every storm. This was a storm in Louisiana. The water is so intense. It's because the oceans evaporate, the water, the clouds are filled with a lot of moisture, the wind pattern changes, so the storms do not move rapidly. So as the storms move slower across the land, filled with water, flooding. And again, the mental health issues. What we saw in Puerto Rico after Maria was a rise in suicides. And so because of the acute injury and the trauma associated with dealing with devastation, extreme weather events, if you put that on populations that are already stressed. So we are very concerned now in this 2023 post-COVID, where we're looking at least 50% of the US population will have some sort of mental health issues. When you have an extreme weather event and heat, we see an increase in suicide, we see an increase in decompensation, and the increase in use of emergency services. And this was definitely demonstrated in Puerto Rico, Maria. And steps that were taken from this will inform how we can respond. But the mental health issues are real with suicides, trauma, and definitely decrease in productivity, and the overall change in mood when you have less trees and a lot of heat and a lot of extreme weather. Migration, as I said, because all the people are going to start moving away from places that are too hot, because there's a lot of drought, they are forced to move. I'm down here in Miami. We see a lot of movement already from South America because there's been drought in Guatemala, in most of the places that plant coffee, and the crops are failing, Mexico, Guatemala, Central America, and the farmers are moving. When we look at from the Horn of Africa, there's a massive change because there's drought in the Horn of Africa. Millions of people are at risk of dying. Right now in Spain, 50% of the olive oil production comes out of Spain. But because of the heat and the drought in Spain, we're seeing a lot of those trees are dying. This causing the population to also move within Europe. Migration is a huge risk, and this is why the US military has put climate change as a major destabilizer in the world, because when it gets hot and dry and no water, people move. Africa is already experiencing a lot of drought, and some of the migration you see in Africa to Europe is because the farmers and many people cannot survive. The entire Syrian war, when they look at it, comes out of the farmers moving from the dry, drought-ridden parts of Syria into cities, which then destabilized the cities and created disruption, political disruption. And look at the massive migration out of Syria. Migration within the United States is also major. Think of the wildfires in California, think of the flooding, think of the massive tornadoes that just happened. Where did those people move to? Because they cannot rebuild in 1 year. And every community will be faced with the understanding of an influx of people and how they migrate. Where I am in Florida, we're having what we call climate gentrification, because the migration away from the coast is happening because sea level rise and beach erosion puts the coastal communities at higher risk. Insurance is incredibly expensive, and the population is moving to the inner part of Florida. And Florida has a ridge that is where the railroad tracks are, and that's where the poor people have always been. And so now with the migration of the richer people into higher ground is causing displacement of poor people from high ground into lower ground. So migration happens in every city. It's happening in different ways. Different cities are impacted. And Hyattsville, I know, is like 100-something degrees over sea level, but Maryland still has low areas. And as that sea level rise, where will that population move? When New York City, which is lower level also, when the storms come in, which New York City is very high risk, where did that population move? So we're looking in the next 20 to 30 years, major migration patterns across the US and the world. And when I talk about folks being impacted now, it is easy to know who will be. Because where you live, where you work, where you play, your access to money and power defines how you're going to survive. It tells you how much wealth you will have to be able to survive now, to decrease your exposure to all the elements, and to be able to protect yourself. So we know that your health is defined not by your genetics, but by your social factors, by where you live, by the behaviors that come from the social factors, and your access to clinical care. And so when all these patterns change and these storms come in and these hospitals get wiped out, or your emergency rooms are not ready, if your access to clinical care because of these extreme weather, that can impact your care. And that can make your risk of what your health outcomes will be. And so low-income communities are at incredibly risk because they're already at higher levels of pollution. The homes that they live in are inadequate with insulation. Or my anime, her house was old, her AC ran, but it was being seeped through the cracks because she had poor insulation. And she could not afford it because she had limited amount of dollars, but because she spends so much trying to stay cool, her energy burden is higher. And we see that in low-income communities across the world and in the US. When I look at one particular population in the Latin communities are the major employment in agriculture, manufacturing, and construction. And when you think of the exposure to heat, and where they live, Texas, California, Florida, they are very high risk for outdoor worker exposure, increased exposure to pollution, increased exposure to all the extreme weather events, and they're in the states that are feeling it tremendously. You know, Florida, California, Texas are ground zero for experiencing all these extreme weather. So we look at these populations, vulnerable, Blacks, Latins, children, older people. And when you look at the age distribution in the last census, America is getting older. America is having folks who are higher risk for not doing well when the planet warms, and less of the young people in that age to be able to support the older population. So we know our vulnerable populations, low wealth communities, people of color, children, elderly, the language issues, and the physically disabled people. They are at very high risk because how did they escape from these situations? And we know the warming planet and all the changes we talk exacerbates existing health issues. Policy matters. This is what drives everything. And when we look at what populations ended up in this position, we got to go back to the biggest policy that happened in 1619, when a group of folks were defined to be less than. And the groups were enslaved, and they were brought into the country, enslaved, and given less access to money, less resources, less access to healthcare, less food, less everything. That population then was placed in places to live that was not in my backyard. You guys know that very well, not in my backyard. So when that factory went in, not in my backyard, and I'm rich enough, when that landfill goes in and the highways go in, the policy from 1619 drives everything. And that policy has driven how you make money, because if the population that were devalued from 1619, thinking about the indigenous people whose land were taken, and so they lost access to housing, they lost access to making wealth, they lost access to health, everything. American Indians are still struggling. They make 59 cents. This is 2018. It hasn't changed much in 2023. Blacks are still under and Hispanics are a little bit more, but Asians and whites still make enough money. What does this all mean? That if there are preparation costs, poor folks can't do it. If you're going to recover from the storms, poor folks are not going to be able to do it. And people became poor, not because of their race, but because of the policies that went in that limited your access to the dollar and limited your access to make a difference. The biggest thing that happened is in redlining, in defining where people live, and in defining where people live and not investing in those communities. They basically created communities. This is Richmond, Virginia. We have ours in Miami. I am sure that you have them in New Jersey, New York. All these areas have been redlined. What it means is the banks said the people in this community will get no additional dollars to put in trees, no additional dollars when it came in, the highways went through these communities, the dumps went in these communities, all the toxic areas went in these communities. These communities are much hotter and they suffer under all of the environmental degradation that we've had. The heat in particular creates what we call urban heat islands. And those urban heat islands, when everybody else is 90, those communities could be up to 100, from 3 to 10 degrees higher. And so those communities have to be monitored differently from other communities because those communities did not have trees, has a lot of concrete infrastructure, and at night, that concrete releases the heat. So my anime, part of her problem, what at night, when she was running her AC, was that she lived in an area with a lot of concrete and the heat came back out from the ground back into her house. And so there was no cooling. And the poor people are paying way more money because they created an environment that they lived in, no fault of their own, but our society created a heat, basically a heat island for them to suffer under. And so we definitely have got to look at our communities. When I look at your Hyattsville, Prince George's County, and you look at the vulnerabilities, what you see, you have a community that has mostly minority. Black, Hispanic, I think 30–40% each. It's pretty diverse in that regard, but you do have a percentage that shows that they're going to have less dollars to be able to monitor and adjust. You have, again, the social vulnerability index that shows how Prince George's County can be with the needs of your community as the days are getting hotter. And you'll see this slide below, the moderate to high, shows that in the last this year, your days are having more days that are in the red. So we predict the usual pattern where you see the blue, that you will get days over 90, but you're already getting a little bit more. And that's the pattern that we anticipate. It's just a few more days that are a little bit warmer than what we normally see. And when you look at the number of days above 90 degrees, and where your hospitals are in the darkness, you see where Prince George's County and Hyattsville is already ticking off, that you've got to be prepared that as the time gets warmer, how will your hospital react? How will your communities react? And especially, do you have heat islands within your city? And again, the US Census shows the areas and the people that are going to be increasing. So the cost of government will probably definitely increase because these populations do not have the dollars to be able to respond. So if there are heat areas, who's going to pay for the AC? Who's going to pay for the cooling centers? That's where we are dealing with now in Miami, because we've declared heat season and we've had to come up with cooling centers because we know that our population is not wealthy enough to be able to make this change. And again, we talk about that 1 degree above pre-industrial level, just getting more than 1.5 degrees, which is getting your temperature from 98 to about 100. Look at the massive melting and extinction that we anticipate. And the problem is that the ice is melting faster because there's a compilation of effects of the melting, and that's causing the oceans to expand, and that's pushing the water. So even without going to dangerous levels, it's just at that newborn. That little increase can be significant. And just premature deaths from the pollution, millions of people right now. And this is Florida. If we did nothing, a bottom half of our peninsula will be underwater. Now we are doing things, and so it's not predicted to happen. But Florida, where so much of where we live, where I am, is 1 feet to 2 feet above sea level, that slight increase can take out a lot of the land. The problem we have in Florida is that the water comes up from below because we are on limestone. So the water is not so much that it's encroaching from the outside, but it's encroaching from below, and it's coming in and seeping into our grass and causing changes in the salinity and difficulty in cleaning and giving us fresh water. So these are challenges that we're facing right now in Florida from sea level rise, and we're putting millions of dollars trying to figure out how to manage this. So we come to our solutions. And again, what we look at is it's urgent. Many of us, we do have time, but it's time to act. And looking at populations, and this is where the governments come in, and what we say is that if we prioritize equity and justice, you get a rapid, more urgent response that saves lives and gives you much more cost-effective solutions. So the Infrastructure Inflation Reduction Act has something called Justice 40 included. It's the biggest climate change act that we've had. And what it says is that as you look for solutions, see which populations have had policies that left them higher vulnerability to climate change. You saw redlining, you saw poverty, you saw where all your factories are, you saw where all your landfills are. How do you do some solution that prioritizes that population? Because that population is going to suffer more. And I use this from coronavirus, but I love this Swiss cheese effect. What we have to do and what our shared responsibilities. When I think of shared responsibilities, we're thinking about what our government and how you vote, because sharing the vote, sharing what we act on, that's sharing responsibilities. It's going to be everybody stepping up and putting in their part. And eventually we put in those solutions, little ones, big ones. For methane, what they're looking at is capturing the methane as it comes out from the landfills, capturing it and reusing it, but capturing it rather than sending it out in the atmosphere. That's one solution. Another solution they're looking at is what the personal responsibility can be. Stop buying so much stuff, decrease food waste. Food waste is a huge problem in our landfills. And so there's cities like New York that's taking a citywide composting issue. There are other cities like in Europe that does a lot of composting. But big issue in the US is food waste, food waste, food waste. Stop buying so much food because when that food degrades, it sends out methane. Red meat, red meat, red meat, another personal responsibility, and improves the health. Cut out all that red meat because then you won't have the cows burping all the methane. You won't have the trees being cut down to raise the cattle. And you get immediate improvement in health, immediate improvement in our planet. Another area, shared and personal, trees, trees, trees. The governments have got to push for more tree planting. Trees improves overall mental state. The data is clear. More green spaces improves mood. Cooling decreases interpersonal violence. The cooler areas have less violence, less fighting, less everything. The cooler the areas are, the more tree-filled the areas are. So there are some simple solutions that can help. The electric cars, I got to commend Hyattsville because you were the first city to change over your police vehicles to electric back in 2017, and you've pushed ahead to electrify as much as you can in your municipal vehicles. And electrification helps decrease the fossil fuel use, especially in transportation. Many of these highways cut through poor communities, releasing too much toxins that's triggering the asthma, killing these kids, sending them out of school, especially with our Black males. Electrification of vehicles and transportation automatically decreases pollution in many of our poorer communities. So these are solutions that can come on both ends. And the ultimate solution has got to be voting to push our governments to make those massive changes in how we use fossil fuels. But together we can do this. We have time, but look at areas that can immediately get it. Dr. Wall, you're on. All the doctors I say listening, doctors, nurses, we are trusted. Nurses more than ever, number one. But we have a role that we can use our trusted position to take this message in our exam rooms, to take this message outside the exam room, to become advocates for health. We've shown that we kill millions of people with pollution. The heat triggers many folks, the asthma, the pollution, you know it, it's here. That's what we do. So if we can understand and translate this climate message to our population, there are 1 million doctors that get 3,000 patients a year. Just do the math. Take this to your doctors, take it to your nurses, take it to your pharmacists. Even think about how are your pills going to survive if you lose electricity because of a storm? How do you treat your person who's on insulin that might need refrigeration? How do I even get to the doctor? I'm in the middle of my chemotherapy and transportation got shut down because of flooding. These are issues that we have to look at as health professionals. So we have to bring it into the exam room, into the health sphere, and stop our role in our pollution, but also educate our patients. We have got to prepare them. 22 million workers. If each of these health sector workers take on this challenge, we have a big role in making that change rapidly. So what are you going to do? You got to get more engaged. There's a book called Project Drawdown that gives you like 1,000 things that you can do. Educate everyone. The data shows that you need about 80 times to hear something about climate to get some movement. 80. So that means all of us have got to take this on in educating ourselves and sharing it, and also start advocating. There are nurse organizations. We have Florida clinicians. If you go to the Medical Consortium on Climate and Health out of George Mason, you'll see all the other states. There's Moms Clean Air. There's so many advocacy organizations that's trying to get the word out that we must vote. This election is crucial because if we switch to folks who are deniers, like one of the candidates that comes from my state said that climate change is politicization of the weather. These are just facts. These are what we're seeing. And whether you want to believe humans or not, the planet has changed. So we have to act. So if we take steps backwards, more people will die. climate change, let me tell you, people will make money on climate change. People will die with this changing planet. Most people who are rich enough will be okay. But for so many as our brothers and sisters in this US and around the world are not going to do well. And we have a responsibility as clinicians, as humans, to make that change. And then think of the insects, the birds, the bees. We cannot live without having our other parts of our planet working together. One of the things we got to look at as clinicians is how we code. And I use code, but it's for me to look at how do we get this new electronic system? AI is here. How do we incorporate AI into what's going on and educating? How do we incorporate AI to say, after a medical visit, if I know that person comes from the zip code, which we know is a heat island, how do I send that information out to that patient? Cities, you guys know where we're redlined. You know what your concrete density, you know your tree canopy. Those areas, how are we targeting those areas to let them know heat is the number one killer? You're not going to be 90 degrees, you're 100 degrees. Get some water, get some shade, get some rest. So there are lots of strategies as we think about it. We got to get the lawyers and the doctors together to come up with ways to move this needle faster so we can protect our patients. We must act now. We have got to include climate change and all of this in everything, our professional schools education, into our curriculum. We need to do some more research, and we got to get policies that helps clinicians and helps the average population how to make ourselves more green, how to make our communities more green, and how to decrease our fossil fuel use. Because as a physician, we got to get to the source. When I tell my patients, do you have heart disease and you're smoking? I'm not telling you to go down to one cigarette. I'm saying we got to stop smoking. It's the same thing with fossil fuels. There is a point where we've got to say, you've got to stop because it is killing our planet. This was a thing that shows this hospital. It's a video, it doesn't come up, but this was a hospital in Fort Myers. That's in the ICU, in the back office and the ICU. It was totally flooded. They had to evacuate those patients. This was one of the patients who started walking around. He was looking for people. This is what happens to your hospitals. This was a doctor who got half his patients had to move out of town because the health system broke down and they had no homes. So when you talk about migration, your patients move, the hospitals move, healthcare access moves. And I close with my patient, Jorge. That's where he lived because he was undocumented. What he has in his hand are a bunch of oranges because he sold oranges on the streets. We have over 300,000 outdoor workers in Miami alone. And at the end of the day, he came into that. You see that concrete, one little window for ventilation right in the top. It's on a concrete slab. It's a concrete building. He was hot. His kidneys would get worse every time the temperature rose. And what he says, what can he do? Rain or shine, cold or heat, he has to work. And that is so much of the world population. And he did this because he wanted to do what he could before he passed from another illness to get the word out that too many of us are succumbing and suffering now from climate change. Too many of us are dying, and they often look like him, Black and brown, poor, living in conditions that are not ideal, but we can do something about it because many times they really can't. They just have to work. And that's the organization, Florida Clinicians, that I founded in trying to get the health professionals involved, because the beautiful thing is every climate solution is a health solution. Every time we decrease fossil fuel, we save somebody from pollution death. Every time we stop the warming planet, we do some improvements. We change the vectors. We change the emotional. We stop the depression. Every climate solution, a health solution. And we can go from a dying planet to what we see on the side. It's an artist that depicted a world that he was an asthmatic artist. And he depicted a world where he could go outside and play, the old people, the young, the people of color, clear, beautiful world that he wouldn't struggle to breathe. And we can do this. We have time, we have the money, we have the resources. This can be done. Thank you, and I'll take questions. And I know Ms. Everhart or Diane, Dr. Wall, you can let me know if there are any questions. And thank you very much.
Thank you so much, Dr. Holder. That was just such a comprehensive and informative presentation, and motivating as well. I'm having spent my career working with postal workers, so many of whom work outdoors. You know, I know what it means to see the environment and the climate change, and I often think of the postal workers who are in places like Florida, Mississippi, places where California, places where there are wildfires and floods and hurricanes and all of that, because they are displaced. And, you know, when these people are displaced, you don't get your mail. You know, each one of us is affected because they lose their homes just like everyone else. They are flooded, et cetera, et cetera. And if we really want our society to be able to work, we want people to be healthy, we have to do something about climate. It is an existential crisis, as you pointed out. I'm really happy to live in Hyattsville, where we do understand the value of composting. For example, we have a program that is expanding. We also have a commitment to trees and planting trees. We have a Department of Public Works with an arborist, and you know, we have a lot of things, as you mentioned, the electrification of vehicles. So I'm happy to live here, but and we want to do as much as we can here. And I think you've made it very clear what the imperatives are. And so I just really appreciate your presentation. And I would also like to tell everyone who's listening that Dr. Holder has offered to donate a part of her honorarium to young women in Hyattsville, and we're working out a way. I'll talk to you about it, Dr. Holder. But we'll be able to help some young girls here. So I just appreciate it very much. Thank you. Thank you so much.
Thank you. I choose women are incredibly, if you look at the women are most of the world, but especially young women are tremendously more impacted from climate change than any other group in the world. And they have to lead the charge, because a child born now, or even somebody at 10, by the time they're 30, they're going to spend a lot of their times with the extreme weather, with the heat, and having to tackle childbirth, child rearing, family, everything. So I want us to look at what we do. And one of the number 8 thing in the world to do is educate girls. And another big thing is to protect women farmers. And the data is so clear. By doing that, you get an increased protection for the family, better use of resources, decreased fossil fuel use, and that turns into a climate solution. So it's not just I like girls, but it's a great climate solution to get the biggest impact for least amount of money.
Thank you so much.
There's a question right there.
Sherry, you want to run the questions if there are?
That was our city administrator, Ms. Douglas, said thank you for your presentation, extremely informative and educational.
And I totally agree with that. It was fantastic, and I think more people need to see this presentation on different levels of government, and we have to see what we can do about that.
Yeah, well, I thank the government, Hyattsville, for doing this and getting it out, because you see that slide, it's shared responsibility. We can't get out of this by individual action. I don't care how many of us stop eating meat, switch to electric vehicles, it's not going to do it because of our timeline. So we have to push our governments to make that massive change, where the factories make the change, where these pipelines less pipelines. I mean, it's a difficult situation because you're seeing more oil being pumped out. And how are we going to get that oil not be used? There are a lot of folks trying to get that we're going to get carbon capture. And the technology might be there. It might catch up. But as we wait for that huge technology to be able to extract all that CO2 out the air, how many people will pass? How many people will suffer? So we know there are low-cost solutions, trees, protection, even something as simple as dehumidifiers. Getting that in homes can make a difference. Electrification, getting the fossil fuel off the transportation, that could make a difference. Stop doing all the red meat, cut out all those ranches that's taking over the Amazon. Pay Brazil to stop cutting down the trees. So there are solutions that will get us some immediate response. And the only thing that can be done is with government. So I applaud the city of Hyattsville in doing this.
Thank you so much for coming here.
Thank you. Thank you so much.
Thank you. Do we have any additional questions? Oh, I just had one that popped up. Ms. Douglas said electric vehicles are still so expensive. Many individuals still cannot afford them. As a municipality, we are looking for grants to help offset the cost of vehicles in our fleet, but are you aware of any opportunities for individuals to get help with purchasing electric vehicles?
Well, the infrastructure that do act, IRA, there's an electric vehicle allowance. It has to be made in the US. Most of the car has to be made in the US. So you have to check that the electric vehicle you're buying is made in the US to get $7,500 back as a tax credit. So it comes right back to you. Now, the vehicles are coming down in cost. I think Tesla is now like $39. The cheapest Tesla, if you can get one, is $39.40. And if it's made in the US, you qualify for up to $7,500. So the average cost of a car with that rebate, they're about equal because cars are coming in at 30 to 40. So we have the law that was passed under the Biden administration basically makes the entry-level electric car available. Now, for folks who don't do as much driving or do under a few miles driving, that's probably the way to go because they're much cheaper to maintain over 10 years. And Hyattsville, I read, put in like 6 public charging stations, and you're not that huge distance apart. So for your community, if you can afford this, you should, and you're changing cars, you should look into electric because you'll be able to get free charging from the city. You'll get the tax refund, and your cost of running the vehicle is less, and you put less fumes out into the environment for children. Now, municipalities, there's a huge amount of federal dollars for electric school buses. It comes through the state and the counties. So that dollars is right there now, and there are millions out there for electric school buses. There's also money for charging stations, and that came through. And if you look at Justice 40, if you're putting your charging stations in the lower wealth communities, there's money for that. There's money to put in trees. Again, the equity lens. And if you look at your areas that have less trees, this might be the opportunity to buy bigger trees. Because if you buy those baby trees because you don't have the dollars, it takes 20 years to get that tree canopy. What these dollars do, if you're looking at equity, it may allow you to get bigger trees because bigger trees are expensive, but it gives you better shade much more rapidly. So this last bill, $1 trillion are out there for infrastructure improvements. What Miami's been doing to do the infrastructure improvement is taking away some of those highways that if you look in the 1960s and 50s and 60s, when the highway system was built in the US, they went through Black communities. They dissected right through Black communities because not in my backyard, the richer communities didn't want it. So why don't we put it in the communities that were less valued anyway and also had no power? Because the Voting Rights Act didn't really come in until 65. By then, most of the highways were already planned and dissecting most of the Black communities. So this infrastructure dollars have been allowing communities to dismantle some of those highway infrastructures. They've also been allowing greenways and underlies and highlines and different things that allows a green infrastructure around some of these highways, underneath these highways, that gives parks. That's a little problematic because they're like the fumes are coming down from the highways onto the kids. So that's why you put that with electrification of our transportation, it makes it easier. Trucks, electrification of trucks should be big, and they're coming because a lot of trucks go through residential neighborhoods, especially in poor communities. And if you can get those trucks electrified, they spew out less of those toxic fumes, again, improving the health. So we have to look for gets bang for your buck. Composting decreases methane, decreases food waste, improves health. Switching to more vegetables improves health. That decreases the amount of fossil fuel you use because you're buying local, because you just said it's Strawberry Festival. Go out to Strawberry Festival, buy all your strawberries, use them, eat in season. You save on packaging, you save on waste, and that then decreases methane. So there are a lot of solutions that improves the health that cities can advocate for, and churches building that relationship so that you can get everybody on board and eventually voting for people who believe in climate change. Cannot vote for climate deniers or for folks who are willing to wait for carbon capture 30 years down the line.
We have one other comment from Betty Dickerson. Thank you for bringing this information to us, and Dr. Holder was fantastic for sharing. Thank you very much. Do we have any other questions?
Well, I can ask. I hear these things and thank you. What have you thought about before? What's the first thing that came to mind when you thought about climate change? And folks can put it in the chat and tell me what you see. And how do you feel your health has been impacted? Because if we don't start asking ourselves these questions, you're not going to connect the dots. So what do we have in our chat? Anyone? What's the first word that came into your mind when you hear climate change? Mayor, what's the first word when you heard about climate change?
Oh, wait a minute, you're going to get something in the chat right now.
Extreme heat.
Right, what you wanted to say. What did you want
Extreme
to say?
heat.
Yes, extreme heat. Another one, mental health increases.
Mental health, good. I can tell you.
Reduction of drinking water.
Reduction, oh yeah, oh, drinking water is huge. The world is facing a fresh water shortage. And other places in the world are already with the droughts, and we know water is going to get much more expensive. So we, just worldwide. And
I'm sorry.
Uruguay, I can tell you, Uruguay is facing the crisis right now of reduction in fresh water, drinking water. And they decided to change their policy and increase the salination level that's approved by the county or this country. And they took water, brackish water from a lake, because it came into water also runs from the ocean. And they put that in their fresh water supply and basically expand their water supply, but it's more salty. High blood pressure, heart failures, all those complications we know will increase. But fresh water, drinking water is a huge problem.
Heat and asthma is another.
Yep. Asthma, you see the rates of asthma. So we're definitely getting that. I got to tell you, when this question was asked 20 years ago, 50, because I've been doing this for a while, folks would say polar bears. That's what most people thought of back then. And it's down to about 40%, still think polar bears.
Well, we want to be around long enough to see the polar bear.
Yeah.
We have a couple of additional comments. More children with disease, anxiety, and illness.
Exactly. The climate anxiety is going to get more and more as more extreme weather, because I think of those tornadoes that went from EF4, EF5. We've never seen that many high, and the expanse of the tornado, the area and the intensity, that's what we see with climate change. Not that the frequency So you're not going to get more hurricanes. Sometimes you might even get less hurricanes. But when you do get one, they tend to be more water and more intense. Same thing with tornadoes. So, and that's what causes a lot of the stress and anxiety.
Global famines, floods, melting glaciers, reduced rainforests. Help.
Yep, definitely. You nailed it all. A third of Pakistan went underwater last year because the rivers overflowed with all the rain that came down in such a short amount of time. You just heard of that, what do they call it? The cyclone, that warm weather where the rain came so much out in California. First they had the wildfires, and California is bracing for the melting because they had so much snow. And this is the problem with the change. So it's this sort of up and down, extreme things that you have to deal with. So now when all that snow cap melts in California, it's going to have a lot of runoff. So a lot of those homes that are on those cliffs and in those land, I think we may see some landslides, a whole lot more landslides. So we have to change how we do things, even in California, holding on to water, because it's maybe you're going to have to change. California has a law where you couldn't collect water in your yard. So they may have to start changing that people start being able to collect their own rainwater, because the rivers are not going to be able to replenish in time from the drought. And when the water comes down, it's going to run into the ocean. So it's a challenge. Everybody is looking at all these climate challenges. And the insurance issues, what I tell most people to look at, because if you're in an area, your homeowner's insurance is going to go up. And that's what's hurting a lot of my poor people who have been able to eke together some money over the years to buy their little old house, and they cannot afford their insurance. So they're now going uninsured. If they paid off the homes, they don't get the insurance, and they don't get the flood insurance. And even when they get the insurance, the deductible to repair anything could be $5,000 to $10,000. So it's massive. And FEMA, again, if you look at FEMA tends to give money back to richer folks because they have better paperwork and better documentation of what they've done. And they can come up with the initial dollars to fix things. So it's not even, so the inequities just compound each other. So if your city is not as wealthy, these are things that the city has to look at. How do you get back from massive flooding? Because after massive flooding comes mold, mildew, worsening of diseases. Mold remediation and is not looked at in many of these budgets. And that's what then drives the health problems after flooding and after these extreme rain. Is all the mold. And who's paying for the health costs with that, especially for children? Yeah, it's a domino effect, but it's doable because you got lots of solutions right now. We just got to push the politician to take action in a way that helps your health now and helps the planet as we wait for some of the huge technological advances that are coming.
Thank you. Any other additional comments or questions? One.
Displacement of people, where will they go? I tell you, that's a huge problem because with the baby boomers retiring, a lot are coming to Florida. And a lot of these folks coming to Florida have never gone through hurricane season. And a lot of them, like I showed you that doctor who got that email from that patient who left the practice in Fort Myers were a lot of old people, and their homes got wiped out. They were too old to even deal with trying to rebuild. So they moved back to their families in Ohio and Wisconsin and anywhere else. So these families that have all the infrastructure in Florida to take care of the elderly, they were taking back folks. So it's like, where do you go? You're going to go back to whoever younger family members and the older folks in the Southern Belt and the Heat Belt. In poorer communities, they're going to have to go somewhere. There has to be retreat from the coastal cities And a lot of cities are not accepting that. They're going to have to help their citizens retreat because it's too expensive to keep rebuilding, and not the insurance companies are not going to pay for it. So who's going to pay for it, and where will they go? The land values in Florida for the inner, safer communities have shot through the roof. So a lot of our poorer communities can't even afford the high ground anymore. And so they're either moving out of the state, or they're moving to the lower ground that is at risk for sea level rise. So I wonder, for us in Florida, with poorer people moving to low level, if there's a storm, the city's going to have to evacuate them, because you have to look at transportation. And what happened in New Orleans after Katrina, nobody had transportation to escape. Most poor folks, I don't know what your level of car ownership is, because when you're evacuating, when you don't have cars, you're depending on the city to get you safe. When you're flooding and everything goes and your old infrastructure goes, you're depending on the city and the counties to give you shelter. So these dollars are not there, and FEMA is often pretty slow to respond. So they're going to move in with families. And so what we look at is internal migration patterns. And I work with Broward County on a panel and a group, and that's what the think tank is, the internal migration pattern in the county for displacement from floods, displacement from storms. And that's first where people move internally with families and friends, and then they start moving out of these states. And as they move internally, the services many times don't follow, because that doctor's practice is in an area where it's devastated. The rebuilding effort's going to take 5 years. He's there. So we're hoping for telemedicine to make up the gaps, because you can't move a doctor's practice rapidly, even though the patients move to Wisconsin and move wherever, and they move other parts of the state. That doctor still has his practice there. So the displacement of the people is real. Displacement of health services and how we continue to provide care for the population is going to really be a huge issue in city planning and management across the board. All the insurers are looking at this, and that's why some of the modern technology may help. All right, we're coming down to the wire. I think we have time for 1 or 2 more questions. That's okay. The main thing that I really want to understand is that this is manageable. Think of that Swiss cheese. Lots of solutions are current. So what we do need is a unified voice in understanding that something has changed. What we've done with pollution is probably that it's just like heart disease. You got genetics for heart disease. You can tick along all you want, but if you put a lot of fat, if you put a lot of smoking, you put something else in that body, that heart disease that was probably tickering all along starts doing this. And you get your heart attack at 50 rather than your heart attack at 90. Or no heart attacks at all. So what did we do? Our diet, our exercise, our smoking, our pollution caused a heart attack in your 50s. That's what we're going to have to do. Humans played a role in what we're seeing in this planet, and humans have the ability to make that change. And we have about 20 years, but if we do it in the next 5, we save a whole lot of lives. Old people, young people, poor people, people of color, all over the world, women are dying and suffering now, and we can change that.
Thank you.
Thank you so
Thank
much.
you so much.
Yeah, it's wonderful.
Thank you. Good luck to Hyattsville. You guys are on the right track. Keep fighting. Thank you.
Appreciate that. Thank you.
Thank you
Thank
so much
you.
for your time, Dr. Holder, and thank you everyone who was online taking part in this very informative webinar. So appreciate it.
Bye-bye.
Bye.
Great Saturday.